So exciting to be with all this amazing energy. Please welcome our guest today. We've got Dr. Marjorie Dixon, who has delivered her share of twins. Janice Meredith, mummy of twins. The boys are Lachlan and Coral. And Karen Gordon, also mom to twins, Barron and Chase. Thank you so much for joining us today, guys. So we're going to talk a little bit about your experiences as parents of twins, but also as a doctor, a fertility specialist, you were delivering twins often.
I don't deliver them anymore. I used to, but now I make them. So I plan the party.
Now you make them.
I plan the party. I don't actually physically make them. I assist in the party planning to end up in sometimes twins.
That's a good party planning business.
Isn't
you
it
have.
fun?
I like that.
Yeah, event coordinator.
I want to talk about how rare twins are. You know, we're dedicating today to them because they're really a special group. So how rare is it?
So it depends on the type of twins.
Okay.
So the twins that happen where an embryo is made and then it splits, and they look identical, they're girl, girl, boy, boy, same blood type, everything, those ones are rare. So those are 1 in 300.
Ooh,
yeah.
All right.
Okay, but if you are fraternal twins, so that means that if there were, your mom ovulated 2 eggs and then 2 sperm came from your father or donor, whoever, whatever, the sperm and the eggs come together, 2 people come from that, those are fraternal twins.
Right.
So in nature, that's about 1 to 2% of the time.
Okay.
But if someone like me gets involved and gives hormones to people, that's even more frequent. It's 27% of the time. So having fertility treatments and fertility specialists has increased the incidence of fraternal or non-identical twins.
But you were saying to us backstage, that's not necessarily the goal. The goal is not necessarily to have twins or triplets or multiples when you have a fertility specialist involved. It's just that often happens. You're trying to up the chances of having one healthy birth.
Exactly. So we always aim for 1 healthy birth, but when we statistically increase by giving people hormones, the likelihood that they'll ovulate more than 1 egg.
Yes.
If the sperm show up and are happy with the eggs, then they'll get fertilized.
Right.
So we're aiming for 1 baby, but sometimes we get 2. Occasionally we get 3, but we don't aim for that.
Okay, nothing wrong with that though. Okay, I want to hear from Karen and Janice. How were you surprised at all when you found out you were having twins?
I was overjoyed.
Oh, you
I was overjoyed. In fact, I just kind of bawled. I bawled the whole time because we have lots of twins in our family.
Yeah.
My mom had twins that had died at 7 days old, and my mom always wanted, obviously, we had the word twin was very highly valued in our family, and then we have twins every generation in our family, twice a generation.
Right.
From your mom's
From my mom's side.
Okay, so that's how it happens. So
this whole thing about it skips a generation. Is that kind of a myth?
No, it's
because we have
myth.
it twice a generation on our side, and so I was overjoyed.
Coming from the maternal side, that's how it's inherited. So grandmother, mother, daughter, the non-identical twins, so the likelihood of spooting out 2 eggs at once that meet the sperm is hereditary. It also is geographically related. So if you're of African descent, you're more likely for it to happen. But if the twins, the non-identical twins, come from your dad's side, it doesn't mean anything.
Right.
It's just
so it's nothing to do with, it's nothing to do with the dad's side.
No.
It's always
so
the
where do we
maternal
come up
side.
with this myth around that it skips a generation? Is that like a total myth?
Oh, there's so many myths
Old
out
wives'
there.
tales? Like,
It is.
People tell you a lot of stuff, right?
Okay. Janice, how'd you feel when you found out you were having twins?
Totally in shock. So I already had 2 others. So I went from having a 3rd to having 4.
Yeah.
So that was a little bit shocking, but it's good. And people had said, it was so funny, people had said, well, what were you expecting? You were 35 trying to get pregnant. I'm like, I didn't know of this. Nobody had told me
so you're more
that
likely.
Once you're 35, your body's a mess. Nobody told me that.
There's not like the eggs are dropping. That's what I heard. I heard that. I heard that like
changed.
when like around the 35 to 30. This is a question more for Marjorie. Like, do they our odds kind of go up?
They do.
See, I'm like asking all these ideas I've actually heard of. So that's true.
I'm debunking the myth, but that one's a real one.
That one's a real one.
Older, we're more likely.
Eh?
When we're younger, our brain sends hormones to our ovaries. We release 1 egg. It's all organized. As we get older, everything becomes a little less organized. So you're more likely to release 2 eggs at a time, and therefore the likelihood of twins, fraternal again, the non-identical twins, increase in your 30th decade. In your 3rd decade, rather.
So what do you need to consider if you are a parent and you are carrying twins? What are the changes that might be happening in your body biologically?
So while they're different in the different trimesters, so in the first trimester, for example, because your hormone levels, the beta HCG that comes from the placenta, is higher because you have 2 placentas, you'll feel nauseous quick.
Right.
So whereas some people have a little bit of morning sickness, if you're going to have morning sickness with twin pregnancies, look at their heads.
I had a permanent barf bag in my purse.
Really?
Oh, like I didn't have morning sickness. I had all day sickness.
And you had a tough time. You were in bed rest at some point.
I had 4 weeks of bed rest in my first trimester, and then second was fine, and then my last trimester I was in total 4 months of bed rest, and severe bed rest. Like they really thought I was going to lose these kids. So I remember dreaming about finally giving birth to, and just dreaming about vacuuming. Like that's really, because when you're in bed, like I felt like a paraplegic. When you're in bed for 4 months, you're not allowed to get out of that bed. I remember just fantasizing about vacuuming. And so anyway, that, I vacuumed and then, and then it went away, the fantasy. But I mean, really, it is like, it's this whole idea where it's amazing what it does on your body.
Right.
Yeah.
Janice, was it a tough pregnancy for you at all?
No, and it was interesting because I did feel more ill, but I had both a boy and girl before, so I knew it was completely different than either of those pregnancies. So it was definitely different. But actually, I couldn't get them. I just wanted them out, and I was so big, and I went past overdue, and I was like, please just get them out. Like I just wanted to move on.
Twins are more likely to come early, actually. People should know that.
I have like a chic boutique.
You have chic boutique, and
I'm like,
it's fancy like you.
Okay, so certain things to consider, but for sure, we're going to talk a little bit more about parenting twins, because I'm sure that people come up to you and say things all the time. Your advice, Karen, and we're going to be talking about this a little more later, is that having two at the same time is maybe not as stressful as having two at different ages when they're young.
Totally. And you know what's so funny? I would have so many people like, oh my goodness, you have twins, that must be so hard. But I would look at my friends who have 2 children in 2 different ages, 2 singletons. I'm like, honestly, I don't think most moms give themselves enough credit. Like, I think that is far more difficult than having twins, because I just had to do the same 2 of everything, right? They were in the same rhythm, the same programs, the same sleeping, the same eating, like everything was like just double. To me, that was so much easier than having 2 kids in 2 different ages. Look at her face. She's like, I'm
She's
watching
doubting you. To be continued.